Good morning, ladies and gentlemen. It's another beautiful day to talk about cancer. On this show, in this episode, we are going to be talking about cancer of the bone. We've prepared a background as to what cancer could be, what could be the general causes, and what could be the way forward. We talked about cancer of the breast in our last episode. In this episode, we are talking about cancer of the bone. There are different types of cancer of the bone. There are general symptoms as to cancer of the bone. And we will be talking about the way forward. Should in case you or anybody is affected by cancer of the bone, God forbid, but just in case. The general symptoms of cancer of the bone. You feel a very serious or severe amount of pain in the joint. It could be here, it could be here, it could be on the knees. You see, it is usually synonymous with that of osteoarthritis that usually happen to older people. But one of the serious symptoms of cancer of the bone is severe joint pains. There is usually a growth on the outer layer of the skin that you can call a tumor, usually closer to the affected areas. So you notice the ball, it's usually in ballish type, such that when you press it, it could pain you, it could not pain you, but you will know that your bones are inflamed such that this growth is extending to the outer layer of your skin. Another symptoms of cancer of the bone is the fact that this tumor is so powerful that it could break the bone when the abnormal cells that have contaminated a specific area in your joint, in your bone joint, when they dominate, they grow so much that they give you all kinds of pain, they give you all kinds of tumor, they bring you all forms of inconveniences. So you need to watch out. And cancer of the bone usually happen to kids, young adults, a lot. Common types of primary bone cancer. Osteosarcoma, that is the first one on the list. What does that mean? It means that around the arms, around the legs, there is a serious amount of pain. This is usual or applicable to young adults from the age of 6 to the age of 12 and above. Then we move on to chondrosarcoma. That is another primary type of cancer of the bone. This usually occur around the cartilaginous. It is simply talking about tumor. It's simply talking about cells that are worn out. It is simply talking about cells that are highly contaminated. It's simply talking about parasitic cells that is feeding from the body, but they are usually around the cartilaginous areas, the joints, around the fingers, on the hands, on the legs, like that. Then we move on to Ewing sarcoma. Ewing sarcoma is another crazy type of primary bone cancer. If you have any of this, that is not the end of the world. You need to reach out to us today. You need to see us. We can consult for you. Then we can provide you with herbal therapy. Remember, the earlier the better. The moment you think you've seen anything in that light, you need to reach out to us and for all so that we know how to approach it. Thank you for supporting what we're doing. See you in our next masterclass.